Our project specifically is with Root Causes, which is a local organization here in Durham that was originally formed by Duke Med students. And we're specifically working with their fresh produce program, which essentially they source food from local farms and package it and have volunteers deliver the food to patients in the area and other beneficiaries who are food insecure and can use some healthy food each week.
There are these things called social determinants of health that could be paid more attention to by the healthcare system. And so these students have come around and trying to identify different kinds of social determinants of health, like food insecurity, housing insecurity, and think of ways that they could find resources at Duke and the surrounding community to address those social determinants of health. Instead of having a central location where people are picking up food and delivering that to the 100 to 150 patients on a weekly basis, we're going to use data to identify 10 to 15 hubs or potential nonprofit partners throughout Durham that we could deliver to, that then could be local, within a block locations that our patients could walk to.
When you take a decision to reach out to more food insecure people, you want to be as effective as possible to reach out to people so that it actually addresses food insecurity. And with data, we're trying to help them come to decisions that can help them do that actually.
We're focusing on Durham, and so you can kind of see, they're called census tracts, so different sections of Durham, and we can kind of overlay, say, poverty rates and see this place has a darker color, so this means there's more people under the poverty line. And then we can plot out the patient addresses to see this is where they're clustered, but maybe there's higher poverty in this other area of Durham. And so kind of visually, but then also make graphs to more clearly see what's going on.
When we work with these patients and get them on a steady diet of fresh local produce, their need for that insulin actually goes down and they're losing weight, and we're really able to embody this motto that we've had for a while, that food is medicine. And in fact, it's a much tastier and more affordable medicine than insulin or some of the alternatives that are being used at the hospital.
Root Causes works out of here every Saturday, and so it's been really cool for us to come and volunteer on the weekends to kind of help package the food, but also see what our data analysis is actually being used for and being helpful for.
It's pretty important for us to see that this data that we are helping them make decisions with is actually translating on the ground.
I think it's really important that the work you do is useful to other people, and so this project especially really stood out to me as a way that I can still refine or learn more about data science and work on my skills while at the same time being able to give back to the community that I'm actually living in and see its impact.